Pull up a chair and buckle up. It's the Original Strength Podcast.
Hey guys, thanks so much for joining us on the Original Strength Podcast. And if you were a regular listener to the podcast, it's been a minute. If you're brand new, well, then nothing's changed. All right. Today on the show, I have the fortune of talking with Dr. Neel Bulchandani. Dr. Neel is an integrative airway chiropractor. So obviously, Dr. Neel, thank you for being on the show. But my first question to you is, what is an integrative airway chiropractor?
Oh, well, thanks, Tim. It's actually I'll add to it. An integrative airway chiropractor is like three-fourths of what I like to say that I do. Integrative airway and feeding. That's like to fill it out. And then some people might be more familiar with if I say that, like, I'm a chiropractor who specializes in helping patients um, prepare for tongue tie releases before and then after. But I'm not necessarily a standard chiropractor who just does that. So what I really do is integrate many different modalities and disciplines and look through what can help people breathe better, and especially with babies feed better, but even adults. And often we're talking about, like, if they have oral restrictions, tethered oral tissues, which they're born with, and it's so many people these days are. And then but it also just could be if their organs are too constricted and don't allow for proper passage of food and digestion. They have constipation. So I definitely bring this kind of integrative approach to problem solving, how to help them, breathe better and eat better, poop better, all those things. The feeding part is mostly when I talk about, like, postpartum moms have, bring their babies in and the baby has breastfeeding issues because of a tongue tie, um, or they're just so tight all over that they can't get that proper latch. Well, I problem solve how to help them feed better so they can get that milk, so that they can be happy and so that they can rest and grow up really well.
So, what got you started? Like, how did you become passionate about helping people breathe better and feed better and to live better?
It just really goes back to my daughter, Serenity. She is the oldest of our three. Two of them got up in the night, so I was getting two of them back to sleep about half an hour ago. So that they're 8, 6, and 4. And even though, so I'd been a chiropractor for 7 years before she was born, and then um, we had her at home, beautiful. My wife just triumphed through that home birth, and when she was born, our midwife pretty quickly did the postnatal assessment and said, your daughter has a tongue tie. And I had no idea what that was. I didn't know they existed. Um, so I was like, okay, yeah, that's but pretty soon, when it became difficult for her to get the proper latch, and therefore she was chomping while trying to nurse, is painful for my wife. So not only that, when she was getting milk, she had a lip tie as well, and so she wasn't getting as good of a seal. So then air would go in, basically creating this crazy amount of gas in her abdomen. And so she was just uncomfortable even when she would get the milk. And so I was on the physio ball. That's the first time in my life that I used the physio ball hours a day was that. So now I use it for other reasons, but I would bouncing her to sleep, trying to soothe her, beatboxing, trying to come up with whatever I could that would help her. um, Long story short, I would say I did it like hours of body work for her a day. I mean, I was doing everything I could think of. I worked on the organs, I worked on the fascia, the muscles, gently adjusted. Yeah, it would help. But then I took her to a craniosacral therapist who knew more than I did. And then I talked to another person, but nothing was solving it. So 3 weeks later, she's 3 weeks old. We had some great friends who guided us, and they said, "Hey, we're a fan of not surgery when you need it, but if she gets a tongue tie release, that might be what helps." And so we checked and found a person that was an expert in it in the Bay Area, and he used a laser, and it was a quick procedure. And I mean, almost instantly, Serenity, that's her name, was nursing better. It was night and day. I mean, hands down, it was like clear, and it was not painful for my wife. And And so then the mini post-op story is that like it requires you to do these post-op stretches almost every 4 to 6 hours for 4 to 6 weeks. So I oriented my schedule. I took 15-minute breaks between patients so that I could make sure I did these stretches. But then I was doing, so instead of 3 hours of body work a day, it was like one, just to adjust your organs and help, because it's not the simple things sometimes of, hey, you get that release and it works. So I guess, kind of the night and day was there. But then for a few months, I had to do really nuanced body work. And I figured this out for her. And then I started to see more patients where I recognized the issue. And then soon after that, I started checking everybody, all patients, intraoral full evaluation. And I found what so many of my patients had a tongue tie, and that's why they had so much tightness in their entire bodies. So I just went in deep and started to create, not only systems of working on this, but then how to teach other people how to do it. And that's what sent me down the rabbit hole, though, was my own daughter.
So I'm kind of like you, like my whole life, most of my life, maybe the last few years, I thought that was just an expression. Oh, he's tongue tied.
Yeah.
What actually is being tongue tied?
Okay. So yeah, it is so the tie refers, so simply the tie refers to the frenum or the frenulum, both the same meaning, and it's a band of tissue. We have 7 of them in our mouths. Everybody does. Whether they're restricted or not, that's the question. So we have a tongue tie, that's the tissue under the tongue where it connects the tongue to the floor of the mouth. And if it's restricted, that means there is both too much tissue and it's too rigid. And then there's other functional parameters we use to evaluate that. Some people have what's called an anterior tongue tie, where the frenum goes all the way to the tip of the tongue, and you can see it. It's like this thing that won't allow the tongue to move up at all. That's more obvious. What a lot of people have that are missed are posterior tongue ties, or now the ones I collaborate with in the field are renaming it to mid tongue tie, but that's just a subtlety. That's when the frenum does not go, is the front of the tongue. That's when the frenum goes about halfway. And even though the front of the tongue can lift, the back of it can't. The reason why that's so important is because, tongue to the roof of the mouth is the first step towards proper nasal breathing. So that's the beginning of it, but also the latch. You need to get that tongue up to be able to breastfeed or bottle feed. So but now you can have an upper lip tie, a lower lip tie, and then these are cheek ties called buccal, Buccal, a right and a left, and a lower right and left. So that's 7 potential ties that can exist in
Wow.
any person. And those are, some people say, well, is it way more common now? Yeah, I think so. Are we spotting it way more? Yeah, I think so. And what are the reasons? And I'm like, yeah, I think so. It's just epigenetic triggers. When we talk about pesticides and we talk about folate and we talk about, there's just so many things I think we're seeing. And those of us that are kind of like digging in, researching, we're always coming up with, yeah, that looks like is more of a prevalence for oral restrictions or tethered oral tissues when you have these parameters going on, when people are dealing with these toxicities. And so it's an issue. And now, when I see a baby, they come in, moms reach out because the midwife or the doula or whoever referred them. Yeah, I'm checking the baby, but pretty soon I'm going to demonstrate at the end of every session when I'm working on this little baby or a kid, I'm going to show the mom or dad, here's what you can do at home. So I teach them body work, and here's how you can release tension. But then I'll check in their mouths and I'll say, oh yeah, you've got a tongue tie. And then if I have the pleasure of working with the grandparents or even the great grandparents, I've had 4 generations in one room at the same time. You can see it run throughout that whole family. So
Wow.
it's a thing, and I would love it if we never had these things. I definitely ask God about that, but right now I'm just thankful to be able to help some with it so that they can, breathe and sleep and feed and do all the things that require our tongue, which is pretty much everything, in one way.
So through your experience with your daughter Serenity, and what you've learned, you came up with an airway map.
Yes.
And in that map, you talk about the floor of the mouth tension leads to whole body tension everywhere. And then you were even just talking about like helping with organs and stuff. So I'm guessing not just tension in the muscles, but tension, I guess organs are muscles too, but different type of
Yeah.
muscle. how does all this work?
Yeah.
How is everything connected like that?
And I think for a long time, there's like some other cool images that have come out in the last decade that have been teachers for us who are in this field, or when we, parents, I'm all these forums that are Facebook forums are the best place for parents who have babies with tongue tied. They're like reaching out to other parents saying, what's going on? And how can I figure this out? And so it's fascia, that's kind of one answer is, fascia from the tongue to the toes. But for me, fascia is part of the explanation, even though it is ubiquitous and it is widespread, thorough throughout the body. I love the research of Bordoni. Bruno Bordoni is a brilliant, brilliant researcher, and he's putting out articles, for many, many, many years. And in my courses, I have online courses that I teach. I reference Bordoni a lot, but the reason I mention that is because he's described fascia as most recent definition of fascia does not just mean that connective tissue that is on top of muscles and bones and organs and that connects things. It can it can actually be right now where we're classifying lymph as fascia, we're classifying blood as fascia, and not to go overboard with it and say, well, everything in the world is fascia. It's just that there is this massive interconnectivity in the body. And I think the how about, kind of when it comes to like, how does floor of the mouth tension create, I say, upstream, downstream issues that twist the body into this particular pattern? Because I see it on, like I said, a 99 out of 100 patients and thousands of patients have fit this specific pattern that I see, with some variance in some, different things here and there. But these 70 points, and I am teaching, or just now, actually, I just finished teaching last night an online course for practitioners all around the world who are working on airway issues. And for context, they could be myofunctional therapists, they could be dentists, they could be body workers like chiropractors or osteopaths or massage therapists or physical therapists, and lactation consultants round that out, as these are the ones who are working on this every day and helping so many out there. But the airway map is something that hasn't come out yet, because through years of poring over my data, I've seen this pattern. And my theory and what I see beyond what's out there right now, because we can say fascia, it's what connects everything, it's why, but I go back to the diaphragm. You've had Carol Agnesans on your podcast, and I love her. You've had, did you have Jaap van der Wal maybe on here? I think he's the
Yes.
embryologist. Oh man,
Yes.
I
He
love
was
this guy.
fascinating.
I love this guy. Maybe you had Michael Shea on here. I don't know, but I'm about to interview Sheriona Menzem Sills on my podcast, because I have a lot of craniosacral, biodynamic craniosacral therapists. Because this taps into my one of my passions is to study embodied embryology. What that means is, embryology, and it's how we formed, but how does it pertain to who we are today? And it's like, of course it does, but how can we even interact with that understanding to find keys that we needed when we were babies? Oh my gosh, I want to go everywhere here, Tim, because with your all the things you've done for so long with crawling, I mean, that we could just talk about. I have my parent, if I'm teaching body work for parents to work on their kids, I have them crawl, and I have them go through tummy time.
Awesome.
I have them reborn so that they can help their little ones. But yeah, I call out the diaphragm as being a huge part of why in development that this fascia contorts and turns us in the specific pattern. So maybe I'll talk about that, and then I'll see if I can share that image of the airway map. But so the diaphragm starts in the throat, in utero, and there's two things that happen about the same time. We're in the womb, right? We're in our tummy, mom's tummies, for about 40 weeks. Let's just call that the average before we're born. 9 months, 40 weeks. Some go longer, some go shorter, but at 4 or 5 weeks gestation, so that means we've still got 35, 36 weeks to go in there. 4 or 5 weeks, our pharyngeal arches form. And that's the basis for oral ties. That's when we begin, if we do have this, to have oral restrictions. Now, at the same time, the diaphragm forms in the throat. That's where it starts. It right there near the same areas of the mouth and the muscles that connect to it, the floor of the mouth muscles. They're called the mylohyoid muscles, and there's 4 of them, but most of us just say floor of the mouth. And then about 6 weeks gestation, the diaphragm goes from the throat to the thoracic level. And then about 8 weeks gestation, it drops into the belly where that diaphragm is for us now. So it's that kind of downward descent of the diaphragm. And the diaphragm is made of 2 muscles, but it's also classified as fascial system. So we start out at this little curled up being, and then we unfold in utero. And then that diaphragm is at the same time going from here down. And it just, that plus other factors, when we have this diaphragm that's starting up here and we have these oral restrictions and that diaphragm descends, it isn't going to descend at the same sort of consistency and rate and alignment as if we didn't have these oral ties. And then I guess the last thing to say is, why do we have this really specific pattern and it's very asymmetrical? I always say we're tighter on the right, most of us on the front, and we're tighter on the left in the back. There's a lot more to it, but it's because we're asymmetrical beings. We don't have the same organs on the right and the left, and even that diaphragm is bigger on the right, and then the kidney is right there next to it, and then we have liver and the gallbladder on the right. We have the the appendix, and then on the left we have the pancreas and the spleen. So we're not symmetrical. Our organs are shaped differently. So fascia will turn and tighten us differently. Some people, if you're wondering, like, at 4 or 5 weeks, that's when the oral ties form. There is a chance when, out of those of us not, because everybody starts with them actually, but they're not called that for most of us, because if we don't have them, we don't even know that we did. At 11, 12 weeks in utero, there is a genetic process that cleaves these ties and it opens things up, and we are just born without them. Those of us that are lucky, I'm not one of them. It's in my family. We have these oral ties. So those of us who are stuck with them, they've been there since 4 or 5 weeks in utero. That means if you're born and you spend 3 weeks, in the world, you've had them for about 38 weeks.
Wow. In my imagination, when you're saying that, and this is just me imagining things, like the spiral tension that we end up developing makes me wonder, is it because our DNA is in a spiral helix?
Ooh.
Like does it start so small, right? Because we're the very essence of how we're built. Then I'm just wondering, like, well, are we just spirals upon spirals upon spirals? But anyway, that's just me.
Well, we could say, oh my gosh, Fibonacci spirals and sequences and vortexes. I feel like there is that. Yeah, I mean, I totally vibe with that, because I feel like I even think, at this phase of working in this field for 8 years now, because it head first dove in with my daughter Serenity when she was born, and now I've been working at this, trying to figure it out, and now as I teach and train others, I'm kind of moving towards this sense of, it's so I don't, somebody asked me the other day, he's like, is this a good thing? I'm like, no, I don't think it is. There's no way that this is good for us. We shouldn't, restrictions in the mouth and this, nobody that has them will tell you that, oh, good. It's a thing that's making me better. We are better in spite of it. It's one of those things.
Right.
But I do think it's this pattern that spins us into this spiral. And I teach intuitive movement classes, and I teach people how to unwind out of these fascial restrictions. And what I think is beautiful, because I get into interpretive dance and the expressive arts. And for me, when I guide people, we can't do these linear things alone, like loosen the mouth and widen the palate and open the jaws and dig into the fascia. I mean, that's good for some of us, and we need that. But also we need, like, to emotionally unwind and deal with the stresses that are with us, and also find a creative way to just unwind the issues that we've got from in utero that might be with us when we don't even know they're there, which is Carol Agnesans and Shuriona Menzim Sills and some of the other great ones I've had on my podcast. Also, they talk about how to guide families through unwinding those stresses that happen in utero. So I do want to tip my hat to those in that pre and perinatal birth psychology field, because I've dabbled in that, but it's not my whole thing. But I think that, yeah, so maybe I could show let me just show that. If it's a good time,
Yeah.
I'll show the image of that. So yeah, here's the airway map. I used to call it the tongue tie map, but the only problem with that is that it's not just tongue tie. So this is who's looking at this map right now. And when you look at this, is this something you resonate with? Because you might not have a tongue tie or even know you have one. You might have a narrow palate. The roof of your mouth might be too narrow. You might even have a narrow lower arch where the mandible's too narrow, or it's retrognathic. The mandible's too far back from birth. Some of these things create the same distortions in the body as a tongue tie. So that's why we've now in this field said it's not just about tongue tie, it's about all these other airway issues. But if you look at this map, just to orient you, this is a person looking at you. And it's a semi-artistic, semi-linear rendering. And if we look down here, Toshi, she's the artist that helped me make this. I love her work. She's both a scientist and an artist. And it's the reason it looks any kind of cool is because she did this. And then I added the details to define it. But if you're looking at a person, so they're looking at you. So, that right side where you see hyoid, right scapula, that's the right side of the body looking at us. So we're looking at the front. So, and as kind of a helpful key, the orange is some of that is so the diaphragm here, the right head, the right bicep, the long head of the bicep. Yeah, clearly you'll see that there are muscles listed here. Then the right kidney, organs listed there, and then floor of the mouth. That's muscle. And then we can talk about the fascia that's involved. This left foot flare down at the bottom. Sometimes I'll put plantar fascia. That is so that's kind of the bottom of the rotation. That foot flares out on the left for so many of us with oral restrictions because the left plantar fascia is tighter than the right. The left, gastroc is tighter than the right. The left medial hamstring specifically is tighter than it is on the right. Whereas on the right, most of us have this right psoas tightness. We also tend to have the right tibialis anterior muscle is tighter. And something I don't put on here, but didn't put on here is the right QL, that quadratus lumborum. But something I'll find on so many people, so many of us with tongue tie is in airway issues is that right kidney and the diaphragm on the right is stuck, adhered, fascially bound. So on most babies, I'm going to be releasing that right diaphragm and the right kidney. And an example of that is if a baby's coming in because they're not feeding well, they have an improper latch. And yeah, it could be because of all this oral restrictions up here in the mouth. But often I can't get that tongue or that mouth to loosen, the floor of the mouth, until I provide some release to that right kidney or that diaphragm. So the map is not just a picture of where people often have these distortions when they have an airway issue like a tongue tie. It's also a very detailed map so that you can navigate. If you're a practitioner, you can work on these areas, or if you're a person that's dealing with this, you can stretch these areas, move these areas so that you can get the mouth, the floor of the mouth to loosen, so that the tongue can lift more properly, so that you can get that tongue to go to the roof of the mouth so you can eat and, feed and sleep and breathe in a much more, facilitated fashion. So there's definitely this intricate overlay of the body that I see. And so if you want to look here at the pelvic rotation, you'll see I've depicted the pelvic rotation where it's, that right hip is often anterior and the left hip is often too high. And then the right scapula is often externally rotated. So the right humeral head, that shoulder is too far forward. And then the hyoid is the throat bone, responsible for speech and swallowing, and even often the gag reflex when it's too hypersensitive in a kid. It's anterior on the right. So that's why I say for a lot of people, we're tighter on the right in the front and things are rotated forward on the right. Whereas on the back, with the left trapezius muscle being tighter on the back, and then all the way down the paraspinal muscles to the glutes and the piriformis and the hamstring and the medial hamstring and the gastroc and the plantar fascia, it's tighter on the back on the left. There's way more detail to that. But, and also I'll say some people have tightness everywhere in their body, all sides, both sides, and that's true. So sometimes I'll feel, whoa, that left side is rigid and the right side isn't as rigid. But the person's like, yeah, it's that right side that I've got pain at. And I'm like, oh yeah, no, you're so tight there also. It's just that this left side, the left gastroc, I can't even move it when I'm trying to dorsiflex your foot. It's so rigid. So, and all of this is not for me, this is what I decoded after years of working on people and categorizing it. And so there's the map is coming from having recognized and helped some people, but also with my heart to help more people, and help people feel understood and identified with what they have going on. I really want this not to be a map of problems, but a map of, a map of answers.
And so you answered one of my questions. So tension in the floor of the mouth can cause all those issues, but you can also address those areas to help relieve tension in the floor of the mouth.
Yes, correct.
Like a two-way street.
Exactly. Yeah. Yeah. Two-way street. And I'll say, you can work in the mouth. And I know we have so many people right now that this is spreading. We have a lot of intraoral body workers who are specializing in this. And I respect what they do because I'm one of them. And also, but I tend to get like the most complex cases referred to me. I work in not only in my city in Reading, but I also go down to the Bay Area to work once a month. And then I fly down to LA every few months to see patients there because I collaborate with some surgeons and tongue tie release practitioners and other body workers. And I see a lot of people have had a lot of mouth work by now, but that it's not letting go because the downstream or upstream effects, whether their cranial bones are really out of alignment or that foot flares going on because that left tibia is too anterior and the left fibula is posterior, and that Achilles tendon is too rigid on that left side especially. Yeah, it's just what you're saying. When those areas in the body are released more fully, you can go up and feel, whoa. I'll often say this, I'm like, the floor of the mouth just dropped. Because when the floor of the mouth drops in its tension, it's so profound what can happen in the body because it not only loosens the tongue, but it's provides this diffuse loosening of the lips and the cheeks and even shifts the palate some. And then it loosens the cranial bones and gets people out of this anterior head posture. And then it goes down and loosens the inner thigh muscles, loosens the calf muscles. So if you can really get the body freed up and the mouth freed up and do this proper syntax of back and forth, you can see so much loosen in the entire body. So working in the mouth is one way, working in the body is one way, but that two-way street that you talked of, so huge when we're trying to help people.
Dr. Neel, is it everything's connected? So is it possible that if a person has tension in the floor of their mouth, it's just going to be harder for them to breathe? So their diaphragm's not going to be as free also, because if the tongue's not free, the diaphragm's not free. And then if they have tension throughout their body because of the tension in the floor of the mouth, could that affect their stress levels, their anxiety levels, their emotional affect?
Yeah. And I just hopped out of that screen share because I wanted to say, oh yeah, what you're, that pathway that you're talking about is such a relevant one. And it's like, I just nod my head and say, yeah, I mean, it's kind of the first thought that I went to though is wild when we can work in the body and free the floor of the mouth. And so many times, as soon as I loosen the floor of the mouth, I'll go down and the diaphragm is no longer restricted. It's instantaneously freed up because so the mouth, the floor of the mouth is an oral diaphragm. We have functional diaphragms throughout the body. There's been a lot of people that have talked about this. I've put out some newer information about this as well. You can identify anywhere from 9 to 14 diaphragms in the body, and even though the belly diaphragm is we can call it the anatomical true diaphragm because it's how we breathe. It does what it does. We know what it does. These other diaphragms, when they're rigid, they don't allow movement at their area and they don't allow movement to move to function as well in other areas, including the belly diaphragm. So when the oral diaphragm releases, it's like this flow of interstitial fluid, this fluidity that goes from the mouth through the entire body. And we can experience that when we work with the other diaphragms also. But I would say the oral diaphragm, because of development in utero, is one of the most profound places to see this systemic release. But then there's some, like, just to kind of get back to what you're saying, we can do that with some. I can work on the diaphragm, work on the mouth, and it doesn't get that, it doesn't release the diaphragm. And sometimes it's all that time they spent tucked in the womb. Or if we're working on an adult now who's had this issue, hey, they've learned their patterns around that, and that diaphragm's rigid. It's caused them to have the anxiety because they can't, oxygenate as well. And then they're also a worrier, and they're stressed out, and then their cortisol levels spike, and their fat increases, and it's their metabolism decreases, and then their digestion's offset. And it is this definitely this domino effect that can happen. So I think this map is kind of like, hey, it gives us inroads into how we can help some people. But I think more of your question is, well, actually I have my podcast is called From Compromised to Alchemized. And it started with this phrase that ran through my head. That was, how can we get people to go from compromised airways to alchemized airways, turning lead into gold, like the book, The Alchemist, one of my favorite books of all time. Turning lead into gold is not linear. And therefore, when we're trying to help people with these issues, it's not like you can tell them, hey, just do this. They're dealing with stress and issues that have been going on for a while. So they need somebody to emotionally resonate with them. They need somebody to maybe talk through some things with them, and I'm not saying I do all these things. Sometimes they have amazing counselors and therapists, and they can talk with their friends about this, but some people need a broader look at what's going on, because this airway thing is here, and it is just a force. And when we have this constricted airway, it just, I see people come in slouched over, and I teach in my movement workshops, for sure, if we're slouched over and you can go like that, try to, and try to smile, try to have a sad thought when you're smiling. It's hard. But well, what I've learned though too is I can't invalidate people's real issues and just get them to move out of all their issues. Sometimes they need a very, very like broad scope of talking about their problems. And anyways, that's a rabbit hole. But I think what you said was spot on. It's trying to find out, in this domino effect on the body, how can we find solutions? And as a, kind of collective, how do we provide places of support because I'll end with this, going back to you, is that kind of how I mentioned earlier with babies, their parents are bringing them in, the parents have these issues, and grandparents can have these issues. It's a family thing, and it's stressful for a parent to try to, and a mom who's trying to care for their baby when they've had issues that probably were there before they even gave birth. So boy, it's a lot. So I love being a place of support, encouragement, hope for these families. And sometimes the most powerful things happen when we're talking about something and they say, wow, nobody's taken the time to ask me that question, or to listen to me on that. And then they'll say, and yeah, like the fact that I can move so much better, or my baby can feed so much better, that's great too. But I think it's so important to highlight the fact that we can carry a lot of stress and burden, but when we can find other people in this village to carry it with us, it lightens the load.
I think it was Sam and Dave had a song, "If there's something wrong with my baby, then there's something wrong with me." As a parent, if there's something wrong with your child, you got a lot of problems, because your heart is so into your child. Like, so it hurts you, I mean, tremendously so. So I mean, I can totally see how if you can help a child, you've helped the entire family, not just mentally, but their heart. That's powerful. And you also got me thinking too, like, if you could set someone's tongue free, or the floor of their mouth free, you could essentially set their whole being free. Ultimately, maybe not instantly, but if you start pulling the thread and unravel things, maybe eventually you get all the tangles and knots out, right? So then it goes back to, the tongue is kind of like the little rudder that guides the whole ship.
Yeah.
And that's just amazing.
Yeah. So for sure. Yeah. There's even, there's even a this sense of the life and death is in the power of the tongue, and it's like we often think about the the words we speak, and now I'm making inferences and as we are in symbolism, but yeah, life and death is in the power of that tongue, and any baby who can't feed, and a parent who's dealing with that, but also I have a 80-year-old who was getting their tongue released by a surgeon, and so one of the things that I do is, if to speak to that, if there's this, she's an opera singer, 80-year-old opera singer, in the
Wow.
ENT chair. She's getting her tongue released because she's had all the therapy before and all that, and I'm in the Bay Area, walk into that office where this surgeon's doing this release procedure, and it's these moments are so beautiful, even though there's it would be great if this person didn't need it, but it's this laser, often it's this laser that they use to just go in and release the tissue, and it allows the tongue to move, and there's therapy before and after and all of that. But in this instance, that the opera singer there, is sitting there, and she's got gauze around her tongue. And so I asked her, hey, because if I walk in a room, sometimes I can feel what people feel through words of knowledge or empathic ways. And so I could feel in her colon that there was an issue with tightness. And I'm just looking at her, and I say to her, hey, are you having any problems with bowel movements? Are you dealing with constipation? And she goes, she shakes her head no. And so then I see the surgeon proceed along with his procedure, and then I can hear him set make some alterations in the frequency settings. Boop, boop, boop. And I know that sound, and that's him trying to find a better frequency to address the tissue that doesn't seem to respond. I had stepped out of the room at that point because there's another dentist in the other room. So I walked back in, and this time I said, okay, so by now I know that if you have that tightness that I think I'm feeling, if I take 10 seconds to release that tightness, it's going to release the floor of your mouth so that he can get a better release. Dr. Zagi can get a better release. And so I'm like, is it okay that I do that? And then he's like, oh yeah, sure. And then the opera singer, said, sure. So I walk up and I do this quick massage on the ileocecal valve of the colon. It loosens, and almost instantly the floor of her mouth drops, and the surgeon goes, oh yeah, I have more access now. That means the floor of the mouth has dropped, and the tissue's more visible for him to do the release on. So it's going to be a more successful procedure where he's able to get more of that tissue released. And so that was kind of the nuance of what I do, is that's kind of part of the map, is using the map to see what do people have going on that isn't allowing them to move better. And in that instance, got to release that colon, because the tongue loosens so he can release it more fully. Because I rely on the beauty of that work, because the body work alone doesn't solve the issues on a lot of these people. They need other modalities. They need the surgery sometimes. And I've had 76-year-old patients, and I've had, kind of people of all ages. And as soon as they get that release, it's like they have vitality, and they have this exuberance, and they just are like, wow, I can get breath in. But it's not just the physical breath. They feel that breath of life. They feel that inspiration. They feel like the things that they weren't able to do because they were locked up, they can do. And so it frees their minds too. And it's really powerful to see that happen.
So we are truly connected from tongue to tail, basically. So
That's great.
when we started talking, you were talking about how the tongue helps with airway, but you said it's more than that. It's also feeding, but it's more than that. It's also going, getting, eliminating and stuff. And so I was wondering, it's like, well, how are they connected? And I think you may have just told me a little bit
Yeah.
on how the tongue is actually connected to how we digest and get rid of and eliminate what we take in.
Yeah. I mean, that is like it's the fascial web, and it's from tongue to toe, or tongue to colon, or tongue to tail. It's like everything's connected. So I mean, there's a lot of other areas that we could talk about too in that connectivity. Like, if the tongue is restricted, it often pulls the occiput forward like that. It misaligns the occiput anteriorly, as well as C1 and C2. And that just constricts the brainstem. And that brainstem is such a house for the vagal tone, vagus nerve. And so then if we can't have that vagus nerve working, which is rest and digest, or I like to call it sleep and poop, just to be clear, for some people with families, it's, if that can't work, our nervous systems can't regulate, and then it's hard for our bodies to do this natural thing, which is just to get that elimination process. And some of us, though, the reason we can't eliminate well is because we haven't been able to digest well. And because there's, sometimes it's also the stomach that's misaligned or constricted. And sometimes it's the esophagus, the upper or lower valve. And if those valves and that stomach can't work well, then the acids, the enzymes can't work as well to break down the food, to emulsify it so that it can pass through that digestive system and deliver that person the nutrients that it needs. And then therefore, by the time it gets down to that colon, it's just stuck. So I see a lot of babies who I work in the mouth, instantly they're going to just get that poop. It's going to happen way more easily. And I think it's helpful to also know that there's the airway is important, feeding is important. So a lot of people, we can start to use this term of the aerodigestive system. That's kind of because the digestive system starts in the mouth, but as well the airway ends in the bottom. So it's like it's one system that is continuous. It's just an anatomy we've separated this because it's helpful to kind of categorize things to talk about it, but it's all one system.
So what you're saying though is nothing is isolated or in a vacuum. So it's not just about the microbiome. It's not just about eating fiber. It's not, it could be about how are you breathing? It could be about, well, are your organs able to move? Are they stuck? So it's a whole picture, not just parts of a picture.
Yeah, precisely.
Awesome. So is it possible if someone was born with a free tongue and everything was fine perfectly and anatomically, their tongue was beautiful, their mouth was beautiful, is it possible for that person to develop floor of mouth tension?
Yeah, definitely. And there's like some really dramatic ways that this happens. And one of those is, it's good to think about the tongue not just as this muscle or muscular system of 8 muscles. And it's also good to think of it not just as a sense organ, taste buds and all, but it's a lymphatic pump, and it's a lever that is a lymphatic pump. So some people have, I just had somebody come in, it was a few weeks ago, and he's come in many times before. And this time when he came in, I could just see he was licking his lips, and I said, "Are you thirsty? Have you hydrated well?" And he said, "Yeah, I think so. I've had some tea and other things." And then I checked intraorally and I saw, oh wow, the roof of his mouth was dry and his tongue wasn't moving well. It's because he was sick for about 3 weeks, or he'd been sick for a while. And in that process, his lymphatic system is congested and his tongue became less mobile. So he had a lot of floor of the mouth tension, and quickly we were able to work through that. And so this is the stunning thing, is like he doesn't usually have this airway map pattern in his body, but that day he did. I was like, oh wow, what's going on here? I'm seeing like occiput C1, C2, anterior hyoid on the right. I'm seeing it's like everything was showing up, and I'm like, that's not your pattern. You don't usually have this. And then it came out, that lymphatic system was congested. There's another way, mold toxicity. Somebody's suffering from mold is on the rise everywhere, but those people that are struggling with mold and it's just taken over and hijacked their airway, their gut also, and if they're dealing with that, often that can restrict the floor of their mouth, and their tongue doesn't move as well, and then their saliva is less producing, and they can start to manifest this map. So I was saying, yeah, to the floor of the mouth tension, and as soon as that floor of the mouth gets really tense, boom, they go into this pattern that shows up with these like 70 something points that show up to. And then I think there's one other way that I'll talk about that is amidst the many other ways, but is who is amazing at talking about this is orofacial myologists. They're myofunctional therapists. I collaborate with a lot of these individuals. They're often the liaisons for care when people are dealing with breathing issues. If there's a dentist that spots it or somebody like me that spots it, they're going to help teach a person. It's like a physical therapist for the mouth specifically. So they're seeing people with TMJ, temporal mandibular joint issues. They're going to see people that have, clenching and grinding because of stress. They're going to see. So these are examples of, yeah, a lot of times there are tongue tie and oral restrictions, but sometimes not. And it's because of stress and trauma and sickness and pathogens. They can impose upon the body this tension there that will start to spin their body into these patterns.
Wow. For the person out there thinking, hey, maybe I've got floor of mouth tension. Are there any go-to movements that you like to, that you could share with somebody that they could do at home or while they're driving
Yeah, I'll show you
or
something.
whatever?
I'll show you something. And if you want to do it with me at all, if you have paper towel handy, you can do it, but you can just watch me
I
too. Or
don't.
you can take, if you can take you can use your fingers as well. I'll just show
Okay.
it like this. I'll show it like this because some people don't, it's funny to touch their tongues. I'll show it both ways.
Oh, I got a
So
shirt.
totally, you're gonna have lint in your mouth, and then you're gonna be dealing with a whole other range
It's
of
all
issues.
good.
I was just kidding. Yeah, there's first of all, there's a very basic myofunctional move called cave or suction, lingual palatal suction, and the first step is, I often say to people, let's have you get your tongue to the roof of your mouth, and I'll show this in a moment. And if you can get your tongue up to the roof of your mouth, create this suction. Tongue clicking is just the tip of the tongue. But see if you can get that suction. And then now I'll have you close your mouths, and keeping your mouth closed, get your tongue to the roof of your mouth and make sure, especially try to get the back of that tongue up there. Although if you're tongue tied, it's not going to be as easy. And then keeping your tongue up there, then open your mouth. Perfect. You're doing cave or suction. And what I can see is you've got some muscular compensation, Tim, on that left side. And that's one of the patterns of the map. I'm not saying anything here, but I'm saying you have more tension on the floor of the mouth on the left. So if people are
I
looking
feel
at
it.
yourselves in the mirror, you can see where you might see some muscle. If you just see a thin band in the middle, that's the frenulum. But if you see muscle or tissue on either side of it, those are the floor of the mouth muscles. Now, that's just kind of like a stretch you can do from 30 seconds to 3 minutes a day. Technically, anytime you're walking around and you're breathing, which should be all the time, your tongue should be on the roof of the mouth, ideally, in most circumstances. It lives there because it's going to help you breathe better. And it's going to also, one of the number one ways to populate healthy gut bacteria is nasal breathing. And that requires you to put your tongue to the roof of the mouth. Um, so then beyond that, how can you maybe stretch that tongue a little bit? And I have people do what's called pluses and X's. Now you can take your fingers and just grab your tongue and do this, or you can wrap your tongue in gauze or a paper towel. What I want you to all to be careful about though is when you stretch your tongue, if you have a tongue tie and you stretch your tongue left and right and up and down, you don't want to rub the frenum on the lower teeth, because if you rub that on the lower teeth, it could be so sensitive and you could nick it, and you don't want to do that because it's painful and you don't want to bleed. Most people won't do this. I'm just saying be cautious. So what you're going to do is you're going to stretch your tongue, and you're going to stretch your tongue out. So you're tugging, not yank it because that's too much for us, just enough till you feel a tug. And when you feel that tug, good. That's step one. Step two is stretch it to the left until you feel a tug, to the right till you'll feel a tug, then go back to the middle, then you'll stretch it up till you feel a tug, down till you feel a tug. You've done plus. Now do X, and that's where you go up and to the left, down and to the right, up and to the right, down and to the left. So I'll show that in a fast version. Good. So you run through pluses and X's. And it's good to slow it down too. So the more you do it, you'll take time so you can feel where is the tug. Because when you feel where the tug is, it's helpful to know, mainly because then you know when it loosens. So the next step is after you feel where it's tight in all those directions, for some people, that's going to be relieving already. Other people, you're going to have some floor of the mouth tension. So I'll have people go in with the tip of their finger, and you're going to go in the mouth and on the floor of the mouth beneath the tongue, and you're going to massage. And you can push down like you push a stamp down, and you can push down at the back of the tongue, the back of the floor of the mouth, and massage forward a couple times. And then you can also do this J motion where you massage towards the middle of the tongue, and you can do that on both sides. And you can take like 10-15 seconds to do that, and it looks like this. And people are going to feel, whoa, that feels sensitive to some, and it's going to feel that way. So you're massaging. You can do both at once if you want, and then maybe a J motion. But then the next step is you're going to take your finger and you're going to have it as back, far back as you can, and you're going to try to lift up to get the back of the tongue to lift. And once you do that, you're going to finish out our exercise. And most of us are going to find that it's not super easy to lift the back of the tongue. Some people, your finger might slip out. So then I'll say aim to the middle like this with your motion. And after you do that, you might feel looser, but sometimes a good way to recheck that, and I'll show it with the gauze, is to round it out, finish up with that stretch. So here's what it looks like with gauze, or you could use paper towel. And some people will feel it right away. They'll be like, oh, my tongue moves more easily, or my lip muscles are freer. My face feels freer. I can breathe more easily. I can stand more upright. That's like my website has a quick version of this. And it's just, it's my name. It's not easy, but it's neelbulchandani.com. But I also have, just for anybody that's interested in more, I teach this course called Tongue Press, and it's self-guided. You can go on there, you can get it. But basically it shows you how to do a lot more than this, to not only free up tongue tension, but to free the floor of the mouth tension, and also some parts of the body. And I have an 8.5-minute video that's called the daily routine that people can do. And if you do this, once a day or even less, it's going to help so much with anybody that has oral tension at all, or TMJ, or headaches, or tight hamstrings, or you can never touch your toes when you bend over, or you can't do the splits, or that right psoas is always tight. So many people, they're dealing with those issues, and they have no idea that they have mouth tension, because they don't have any issues here, but it's in the body. And so if we can work in the mouth to free the body, sometimes I'll say they've been to the best people. They've been to people I'm like, whoa, you were that person? You went to that body worker, you went to that chiropractor, they're amazing. I love their work. But, oh, I see what happened here. And sometimes it's clear as day to me, and other times it's really tricky. A good example of this is somebody came in a couple weeks ago, and their taste buds were off. I could feel the taste bud area on the back of their tongue where the bitter taste buds are. And I asked them, have you been tasting anything oddly? And they say, yeah. At first they said no. And then I'm like, are you sure? It's like a bitter taste. And they're like, oh yeah, that's right. Last week, everything tasted strange. And it's just been tasting weird ever since. And so I worked on those taste buds, the papillae. And right after I released those taste buds, the floor of the mouth tension reduced, and the tongue could lift more easily. And I could get to dealing with a part of their body that was actually the reason they came in. It was a rib up here on the left that wouldn't adjust otherwise. And I could go down the rabbit hole of why that rib was misaligned, because the rib was misaligned because the scapula was misaligned. The scapula was misaligned because the subscap was too tight. The subscap was too tight because the right medial bicep was too tight. And so for those of us that have airway issues, left medial bicep is often so tight. And if you work on it like this, as if you're doing a bicep curl, and you squeeze that medial head of the bicep, it's this nonlinear release of your subscap. The subscap will free up, and your scapula will reorient, and then those ribs can go into alignment way easier. So that was all. The taste buds that's not why she came in. It's that rib, but I couldn't get the rib to release until I identified that pathway. And it's kind of like, that's what I love doing, because, hey, I had no idea that was going on, and I didn't even know how to figure that out until it showed up in the moment. So I just, say that if anybody out there, I just want, some people have these issues that have been with them for forever. Don't lose hope. Sometimes it's the mouth. Sometimes it's the nostril. I do intranasal work, so I release the nostril bones on people that can't breathe through their nose. Sometimes it's other issues, but so I'd love people to say, if you ever need help, just we'll reach out. I'm always happy to direct you to somebody maybe in your area that can help. But man, I just love that when people come in and feel better, they are able to do what they're supposed to do in a better way and live in a better way. And I know that because I've had my own issues that have shown up, and until I found solutions for them, I didn't even, didn't even realize how much it was burdening me. So I love being in a place of hope and answers for people. So it's really just, I'm so thankful I get to do what I do. And like I said, I was saying, if my daughter hadn't had this issue, I would have been way happier because, boy, that would have been so much better. I would choose that path in a heartbeat because that's not. I don't want to have the issues that have led to me. Because my other kids had tongue tie, and we've had to work through a ton of issues with them, and they needed help. So, boy, I wish we didn't have this, but because they did, um, you know, I've been able to pour into this and figure out something that I want to impart to people so that they can have an easier time in their lives.
Now you can change a whole lot of lives. Dr. Neel, if someone wants to learn from you or somebody wants to see you, be treated by you, where can they go?
Oh, well, there's the people can find me at Dr. Neel Bulchandani on Instagram, and I'll share that. And then also my website's www.neelbulchandani.com. If you just type in Neel and tongue press, some people are going to Google that. I got that resource out there, and so if anybody wants to go online, you can get my tongue press course. That's for anybody with a tongue. My floor of the
Okay.
mouth class, my floor of the mouth class is for practitioners and healers, and that is a 6-week class that's really in depth and a deep dive. And then if you want to do a virtual session, I do those. You can find me that way or at drneelteam@gmail.com, and you can schedule a virtual session with me in person. I'm here in Redding, the top tip of California. I'm also in the Bay Area in LA. And just tune in, and I'll be sharing more about some upcoming things that I have going on. But I'm always wanting to be a resource, so come find me, and I'm always happy to answer questions if you have them.
All right. And if at home you found this podcast to be helpful, please share it with someone. You may make a huge difference, and spread the good work that Dr. Neel is doing. Dr. Neel, thank you so much for being on the show.
Oh, thanks. It's an honor. I just want to say, I know we're tailing it here. We're coming to the end here, but I just want to say I have been a huge fan of your podcast. I love what you do. I love your nature, um, the way that you just kind of interact with people. The range of people you've had on this who have spoken so highly of you, speak so highly of you, even though I would say the same thing. Mark Hamilton with the Soleus push up, and just a bunch of other people. I just want to say I'm one of your fans. I love that you're doing this. Or you came back to do an episode with me, and I'm so grateful because it's been a dream of mine or a desire of mine to be doing this with you. And I just feel so excited that we got to do this. And I'm really thankful for the opportunity. I have the answer to your question that you always ask people. If you want to ask me the
Yes.
special question.
Well, do you like peanut butter?
Oh boy, I was telling my kids about this question last night because I said, I'm going to talk to this guy too. He's amazing, and he's going to ask me if I like peanut butter because I ate a lot of it yesterday. So, yeah.
So the answer is yes.
Oh my gosh, I love my favorite lunch is 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 I'll answer your questions is creamy Costco organic peanut butter
That is good.
because
Oh, that's
it
good.
comes in a big tub and we eat a lot of it. And yes, I like Justin's, like I think Jennifer Pilati mentioned or something. I like all the organic crunchy. I love crunchy, actually. That's my favorite. But I bought crunchy the other day, and it just was like it wasn't as easy to spread. And I'm like, I don't know. Maybe I'm changing my ways here after 20 something, 30 something years of loving crunchy peanut butter. I eat creamy peanut butter almost every day because I make a nut butter and jam and cheese sandwich that's fierce. It's delicious. It fills you up with that fat. And I feel like for my body work, I'm working 8 hours of deep, structural integration, sifting through tissues and using my mind. And whenever I eat that nut butter and jam and cheese sandwich midday, this is not a commercial for Costco or for peanut butter, but I just I love it. So, yeah, I'm a big fan of peanut butter.
That's very fitting because everyone knows that peanut butter is one of the best ways to strengthen and stretch out the tongue. So that makes
I
that makes a
love
lot
it.
of sense
That's
to
a good
me.
one.
I got
Leave
one
it
more
to you.
question.
Oh yeah,
One
go
more
for it.
question for you. Nut butter, jam, and cheese. What type of cheese?
So most of the time, I'm eating either Miyoko brand or Chow cheese. It's a plant based cheese, so it may be made of tofu, or it may be which fermented soybeans, or maybe it's made of like coconut, and some other things. And but Miyoko is a beautiful like vegan plant-based creamery that has it's made of cashew. So usually I'm eating a nut-based or a tofu-based cheese that has some good protein in it.
So it's almost like kind of combining two nut butters in one. That's kind of being greedy, but I like how
Yeah,
you're
yeah.
doing there. I
Yeah,
like it.
sometimes I'll add another layer and put on Miyoko vegan butter. And so I got nut butter, cheese, and nut butter jam. Yeah, I got all that going
That
on.
that will definitely exercise the tongue. All right.
Yeah, that's right.
Dr. Neel, thank you so much for being on the show. This was awesome.
Well, thanks so much, Tim. And yeah, a pleasure to be with you.
Thanks for listening, everyone. If you found this helpful, educational, or useful, please share it with a friend. Now get outside and play.